Okay.
Yes.
PRECEDE PROCEED model.
Yes.
Origin developed
Yes.
by Green and Keruta in 1980s. The nature is a comprehensive planning framework for health promotion and disease prevention. PRECEDE diagnostic phase. Number one, social assessment, community needs, epidemiological, behavioral, and environmental assessment. Education. Number three, educational and ecological assessment, predisposing, enabling, reinforcing factors. Administrative and policy assessment, proceed, implementation and evaluation phase. Number five is the implementation and intervention. Six is the process evaluation. Number seven is impact evaluation, environment, behavioral stroke and environmental changes. The outcome evaluation is number eight. That is the long-term health outcomes. Then application in nursing, community diagnosis, planning large-scale health promotion intervention, e.g. maternal child health and HIV and AIDS. Evaluation of public health programs. The strength is to integrate multiple determinants of health.
You can finish.
The limitation, resource intensive and complex. I think I finished.
Okay. Thank you. Thank you. Thank you so much. So, what we can say, it is that this particular model, basically, it is looking at the why, or behind health problems. Why are we having? It is talking about the why in relation to health. Now, so this particular model was developed by this guy here by the name Green and Creta in 1980s, and it was more on the precede is more on the on how to diagnose in relation to social assessment. Now, when you're talking of social assessment, we are talking at how to identify the social problems and the need of a community, be able to determine the desired community outcomes. That is all about the social assessment. Now, when you are looking at epidemiological, behavioral, and environmental assessment, it is about identifying specific health problems and their determinants. Now, when you're talking of determinants, we are looking at the risk factors. And within our environment, we have got many risk factors that can be able to make us to have a particular condition. And sometimes we go to the extent of saying, what are the causes? When you're talking about the risk factors, then what are the causes? Then there is what we call educational and ecological assessment in regards to predisposing factors, enabling factors, reinforcing factors. Now, yes, as much as we're able to look at it, so we normally look at, do we have the knowledge, the attitude, and the skills that is required for us to be able to tackle these predisposing factors or enabling factors or reinforcing factors. Then we look at the administrative and the policy assessment. Yes, we normally try to evaluate existing, yeah, evaluate existing administrative and regulatory measures, policies that are there in place. And if we have, do we have policy resources available to support the program when you're looking at the administrative and policy assessment? Then we move to proceed, implementation and evaluation phase. So the first one is about diagnostic phase. Then this one is about now the doing and the evaluation. Now it focuses on the implementation. Implementation, it is about the intervention. Now, we carry out the intervention using the policies. That is what you need to know. We normally carry out the intervention using the policies and the regulations. What is regulating us to be able to offer a particular service? Then the process evaluation. So the process evaluation, we normally assess, we try to assess the program's process, the results and outcomes to ensure that we have got effectiveness and we make necessary adjustments. So that is all about the PRECEDE PROCEED model. Now, how is it applied in nursing? Now, in nursing, it is applied in community health nursing to be able to do what we call community diagnosis. Now, community diagnosis, I know at some point you will be able to do it now practically. I know there is an element of community diagnosis somewhere whereby we have got phases of doing community diagnosis. And when you are looking at community diagnosis, we normally talk of we try to explore. Then after exploring, we normally have what we call pre-planning. And then we plan, and then we do what we call intervention. Then after that, after the intervention, we are able to do what we call evaluation of what has been done by giving feedback to that particular community after doing the community diagnosis. Another thing where we can apply the PRECEDE PROCEED model is planning large-scale health promotion intervention like maternal child health and HIV thing that we can be able to utilize in nursing, or we can be able to employ this particular PRECEDE PROCEED model is evaluation of public health programs. So this particular, as you have seen in relation to my explanation, we do diagnostic, there is diagnosis, implementation, and then evaluation. So it can be able to assist us to find out if a particular program is working or not working at the end of it, after trying to employ it in a particular, or trying to ensure that you are trying to apply it somewhere. So you try to find out the weaknesses and the strength. Now, how is this particular PRECEDE PROCEED model essential? Now, we normally look at the strength. So we try to interpret multiple determinants of health. Now, when we're talking of multiple determinants of health, we are looking at biological determinant of health, the social part of it, the physical. We normally look at gender. We normally look at gender health. So those are some of the determinants of health. Now, limitation. It is resource intensive complex. So you need to have resources, enough resources for you to be able to partake this particular model.